It's time for another edition of Meet the Doc, Mercy Health, Orthopedics and Sports Medicine, a proud partner of the Skyline Chili Crosstown Showdown. And today I'm joined by Dr. Lisa Vickers, who is a orthopedic surgeon for Mercy Health, specializing in the foot and ankle. Doc, welcome.
Thank you. Thanks for having me.
Glad to have you. Let's find out a little bit more about you, right? I understand you're a native Cincinnatian, so there's a lot of lineage in your family from Walnut Hills High School, right?
Yes, we had 3 generations of people from my family that went to Walnut Hills, including myself and my brother, my parents, cousins, and my grandparents. So, long history.
All right, have they
Cincinnati born and raised.
Have they reached out to you about putting that name on a building or anything like that yet, or is that in the future, maybe? Right.
That's in the future. I think,
all right.
Yeah.
Well, now I couldn't help but notice you have an interesting you have an athletic background, right? You played rugby. You were also a cheerleader, and I got to be honest, that's not a combination you see every day. How'd that come about?
You know, I think I probably got into rugby for the social aspect of the game, but had a great time. Loved cheerleading, loved watching football, loved being, an athletic supporter, and it was an athletic sort of an activity for us too. Sort of well before the cheerleaders these days get real big into the gymnastics and flips and things. But
I got you. Well, now you're also one of the team physicians for Cincinnati Ballet.
I am.
That's the team that you kind of help take care of.
It is.
So, and that seems pretty cool, right? I mean, the Cincinnati Ballet is very accomplished.
It's fantastic. These are an amazing group of athletes, and they are just a wonderful group of people to work with, and I'm really honored to be able to be part of the team that tries to keep them healthy and dancing.
Well, we're going to talk about a couple things that we haven't chatted about much, but tell me about Sievers Disease. Explain that to me and explain that to everybody out there, what it is and basically what are some of the components, treatments, etc.
Yeah, Sievers Disease is one of those really common growing pains kind of problems that we see our kids and our athletes suffering from. It's essentially an inflammation of the growth center in the back of the heel, sort of right back there where the Achilles tendon attaches. And so we see these kids that get going in sports in the fall and throughout the year and start running and overusing, more than what they're typically used to. And sometimes that growth center gets inflamed and you end up getting these heel pain syndromes, a lot like we adults get when we're talking about Achilles tendonitis or plantar fasciitis, those kinds of things.
Well, what are some recommendations? I know we haven't talked about this at all, but footwear. I know I've got, a son, my youngest son, plays football, played soccer previously, and, I think they have a tendency sometimes they don't, shoes fine, whatever. But I'm guessing that choosing the proper footwear and wearing it correctly, etc., is really critical.
Yeah, we do see a lot of this, some of those pain syndromes come when kids start running and the ground is hard, or they're running on the hard track and they're wearing cleats that don't have a whole lot of cushion or support, which is sort of the nature of a cleat. But in general, we would recommend that they wear a good, well-constructed shoe that has some good cushion and midfoot support, and try to add a little bit of that to a cleat from time to time with an off-the-counter, over-the-counter kind of arch support or heel cushion that can help to absorb some of that shock.
What would you recommend for parents and for student athletes, too, when they're selecting footwear? Because I know a lot of times, there's the big box store, you get on the internet, you try to find. What is a good way to go about selecting the right type of athletic footwear? Yeah,
I just tell my patients usually it's just really about making sure you identify a shoe that fits you well and that is well constructed, that has a good, heel and midfoot support. It's, hit or miss sometimes when you go to a big box store like Dick's or DSW or one of those places where you're trying to fit yourself. So oftentimes we just kind of point them in direction to one of those stores that will have a salesperson that will take the time to measure them, and sometimes watch them walk or run or on a treadmill to see what kind of gait pattern they have, and then make some suggestions on a shoe that might fit them appropriately.
Let me ask you a final question about the foot and ankle. Obviously, we talk a lot in sports about injuries. Concussions have been a hot button, shoulders, knees. But boy, you use your feet and ankles. Mm-hmm. I mean, anything you do where you're running, what are some of the most common injuries that you see from younger athletes, and what are some of the best prevention methods? And I guess sometimes it just happens, and that's when they come see someone like yourself, but hopefully you can help prevent as many injuries as possible. Yeah,
always important to try and stay flexible and strong, build those core muscles, work on balance and proprioception. We see a whole lot of foot overload syndromes that stem back again to the tightness in the calf muscles and the Achilles tendon, and so incorporating a good stretching program for the Achilles and the calf as part of the routine fitness and their strength training is important as well.
Interesting to hear you say about stretching. I know my youngest, when you mentioned stretching, I think he bends down once and goes, I'm ready to go, right? That's probably not what you mean, right?
That's not what I mean. And, kids are so flexible and resilient that it's hard to beat into them. It's the importance of doing that stretching early on, but it catches up to you pretty fast. So.
All right. Well, it's been great to meet you, Doc, but I got to ask you, this is the final question. You're a native Cincinnatian.
Yes, sir.
So, right? If you're a native Cincinnatian, I'm guessing you've been to Skyline Chili a time
or
two, right?
1 or 2 times, yeah.
Okay, so we ask every doc this, and it's been funny, the variance of answers. Do you have a go-to? Is there same every time, or do you mix it up?
Oh, no, straight up 3-way. Extra oyster crackers.
Hot sauce or no?
A little bit of hot sauce, Diet Pepsi, but yeah.
All right, there you have it. See, everybody's got their own. So it's a pleasure to meet Dr. Lisa Vickers, who, again, takes care of Cincinnati Ballet. And if she's good enough to take care of Cincinnati Ballet, she can be good enough to take care of you. Orthopedic surgeon specializing in the foot and ankle. Doc, it's been a pleasure. Enjoyed meeting you today.
Likewise. Thank you.
All right, this has been another Meet the Doc from Mercy Health. Again, Mercy Health, Orthopedics and Sports Medicine, a proud and outstanding partner of the Skyline Chili Crosstown Showdown.